We are going to be performing an arterial line on our patient today, basically also known as an A line. I've already verified my orders. I have checked my patient and done their patient assessment. Now we're going to go ahead and get their blood sample. So first things first, we're going to go ahead and check that our bag is pressured and it's between 150 to 300. We're also going to go ahead and check that their waveform is normal at the moment. And then we're going to go ahead and continue to start. So we're going to make sure that we have alcohol pad, an ABG syringe, a waste syringe, a label for our sample, and a cap. So we're going to go ahead and aseptically remove the cap. Make sure that it's not touching anything and that we're laying it face up. I'm going to go ahead and use that pad to go ahead and clean off the port. And now we're going to go ahead and attach our 10 cc syringe for the waste. So we're going to go ahead and open this up and we're going to pull 10 cc's of blood mixing with the saline until we see nice big red thick blood. Okay, now that we have that, go ahead and close it. Take this off. Gather our ABG syringe so we can actually get our sample now. Go ahead, matter of fact, let's do this. So you can see we still have a little bit of air bubbles. So what I'm gonna do is go ahead and reattach this so we can get those air bubbles out. And now we have big, thick blood inside, okay? So take that off. I'm touching this one again. Pull it all the way back. And making sure we have nice sample of blood. And close this off again. Before we attach the cap, we want to make sure that we check for air bubbles. So we can see there's one at the top. Go ahead and tap it and try to go ahead and get it out. There it goes. Boom. All right. I'm gonna go ahead and attach our lid. Make sure it's up. Good. I'm gonna go ahead and put the label on this. Make sure that it's filled out with the patient's name, their date of birth, the time and the place that it got taken, and also, what was it? Device setting and fire tube variety. Okay, put this back in here, close it up so it's ready for the lab. Now before we head out, we're gonna go ahead and clean the line. So, I'm gonna go ahead and point this towards our patient. Let the saline wash out the port. When it's washed out, we're gonna go ahead, pat it down. And next up, we're also gonna go ahead and put the cap back on now that it's clean. Point this way. And now all we're doing is flushing the line and flushing the blood back into the patient. Now that we have done that, we're gonna go ahead and check the waveforms again and make sure that they're back to normal. After this, we go ahead and gather everything, make sure that we're throwing away all of our trash, and anything that needs to go into the biohazard goes into the biohazard, and then we run our sample to the lab.